Welcome back to the channel. Today we're going to walk through a full cardiovascular examination in a clear, simple, step-by-step way that's perfect for OC revision or clinical practice. We start the exam with a professional introduction. Hello, my name is I'm a medical student from I've been asked to perform a cardiovascular examination on you today. Is that okay? Can I confirm your name and date of birth, and how you'd like to be addressed? Next, explain the procedure in simple, non-medical language. This assessment will involve me checking the pulses in your arms, legs, neck, and groin. I'll also be listening to your heart with my stethoscope. If anything feels uncomfortable or if you'd like to stop at any time, just let me know. And before starting, always ask, are you in any pain at the moment? Now we begin with the general inspection. Stand at the end of the bed and observe the patient carefully. Look for any signs of cyanosis, shortness of breath, or general pallor, which might indicate anemia or poor perfusion. Also look for peripheral edema in the lower limbs, which can be associated with congestive heart failure. This brief inspection gives you early clinical clues before you move into the physical examination. After this, you assess the pulses, starting with the radial pulse on the thumb side of the wrist. Then move to the brachial pulse, which is found on the medial side of the cubital fossa, just inside the elbow. The carotid pulse is next. Use your index and middle fingers. Begin by finding the trachea, then move laterally into the space between the trachea and the sternocleidomastoid muscle. Remember to use your left hand to check the left carotid and your right hand for the right, and never check both sides at the same time. Now move to the lower body pulses. The femoral pulse is located midway between the anterior superior iliac spine and the pubic symphysis. The popliteal pulse is found deep in the popliteal fossa behind the knee. Position both hands, press firmly, and feel carefully. The dorsalis pedis pulse can be located by following the tendon that appears when you lift the big toe. The pulse lies slightly lateral to that tendon. And finally, the posterior tibial pulse is found between the medial malleolus and the Achilles tendon. Next, we assess the jugular venous pressure, or JVP. This gives an estimate of right atrial pressure. Position the patient at a 45-degree angle. Ask them to turn their head slightly to the left and shine a light diagonally across the neck. You're looking for a double, wave-like pulsation. The JVP is not palpable. It has 2 peaks per heartbeat, and it changes with breathing and position. You can also use the hepatojugular reflux. Gently pressing on the right upper abdomen should cause a temporary rise in the JVP. A normal JVP is less than 3 centimeters above the sternal angle, which corresponds to a total height of less than 8 centimeters of water, since the right atrium lies about 5 centimeters below the sternal angle. A raised JVP can indicate right-sided heart failure, pulmonary hypertension such as from COPD, or tricuspid regurgitation. Understanding the basic JVP waveform helps make sense of what you see. The A wave is caused by atrial contraction. The C wave occurs when the tricuspid valve bulges into the atrium during ventricular contraction. The X descent follows, representing atrial relaxation. The V wave is created as the atrium fills with blood, while the tricuspid valve remains closed. Finally, the Y descent occurs as the tricuspid valve opens and blood flows from the right atrium into the right ventricle. After assessing the JVP, move on to palpating the apex beat. It is normally found in the 5th intercostal space at the mid-clavicular line. Use the palm of your hand first, then narrow it down to 2 or 3 fingers. If the apex beat is displaced laterally, for example into the axilla, this may suggest left ventricular enlargement or heart failure. Now we perform auscultation. Listen carefully to the 4 valve areas. For the aortic valve, place the stethoscope to the right of the sternum in the 2nd intercostal space. For the pulmonary valve, move to the left of the sternum at the same level. To listen to the tricuspid valve, Place the stethoscope at the left lower sternal border around the fourth intercostal space. Finally, listen to the mitral valve area in the fifth intercostal space at the mid-clavicular line. It's helpful to palpate the carotid pulse while listening, so you can time murmurs with systole and diastole, and that completes the cardiovascular examination.